Okie dokie, everyone. Good evening. Good evening. We're coming live on YouTube. Looks like we're almost live on Facebook. And I am Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. And tonight is the intro video for Alzheimer's disease. If you know someone with Alzheimer's, if you have a loved one with Alzheimer's, you may want to watch tomorrow night. I'm going to go through the detailed physiology of how this process gets set into motion. I think it's important for us to all know that if you are worried about Alzheimer's, it's really important to think of brain health, in my opinion, once you turn 40. Preventing Alzheimer's is the thing, because by the time someone develops Alzheimer's, it's really difficult to do anything to help them as much as we'd want to. I'm not saying that some therapies are not effective. Certainly some therapies have shown to be effective, but it's way easier to address the issue early on, so to speak, rather than once a lot of destructive physiology has really set into motion. Tomorrow night, I'm going to go into how blood sugar dysregulation is a major facet of the causation of Alzheimer's. And when we think of our society, we would know that many of us are going into pre-diabetes and diabetes. I think it's a third of the American population is pre-diabetic. 10% are diabetic, and those numbers are forecast to increase a lot in the coming 20 to 30 years. What that means is that we're going to have more and more patients with Alzheimer's as well, which is a huge problem because taking care of Alzheimer's patients is incredibly expensive on the system, not only devastating, also for families trying to take care of a loved one who literally is not able to remember things and has trouble functioning in their activities of daily living. Alzheimer's really is a neurodegenerative condition, and some neurologists have called it failure of the brain. And it's a pretty serious condition that we want to be attentive to regarding Alzheimer's. So hopefully from tomorrow night's discussion, you're going to have a lot more information on what you can do to prevent it, the symptoms of Alzheimer's that may be presenting early on that a lot of people attribute to, old age or senior moments, as I've heard them termed, or, there are other terms for them too, which I won't go into, but senior moments, I think, is a good description. And if you're noticing these signs, what can you do with a loved one to get them checked and taken care of? We'll probably also talk about medications and what medications are effective and what natural supplements are effective. We'll probably go into something called the Bredesen protocol. Dr. Bredesen has a whole list of supplements he uses and dietary therapies that was published, 3 years ago or so, out of UCLA, where basically he showed that 10 out of 12 patients going into Alzheimer's were able to go out of Alzheimer's with dietary therapies, which demonstrates the importance of foods as it relates to this brain condition. So if you have any questions on Alzheimer's, let me know them. Send them to us tonight, and I will go through them tomorrow when we do the video. And I hope you all have a wonderful Thursday evening. Take care, be safe, and I will talk to you soon. All right.